These days, NEET post-graduation examination and NEET super specialty examination counseling has been going on. I am Dr. Vikas Gupta. I am a neurosurgeon at Kailash Deepak Hospital. To put in context, my both children are doctors. My daughter is doing MCH in Gujarat and my son is in final year of MBBS. So I was reading social media, newspapers and all these things. Which specialty is better? Why to choose which specialty? Some children are using words like toxic or this or that. I'll not go into that. But in my opinion, with my experience, I believe it is about 35-40 years. If you want a comfortable life, don't go in for surgical specialties. Why? Because you are dependent on a hospital. You cannot buy a machine of worth crores of rupees. You cannot buy instrument worth lakhs of rupees. You cannot create an ICU, at least in Delhi or NCR. If you are a rich man, of course you can. But you are dependent on the hospital. You want a comfortable life, go for medical specialties. Like endocrinology. Diabetes is something which is an epidemic in India. You'll be never short of money and you'll be doing a service to the humanity. Like neurology. Again, there's an extreme shortage of neurologists. And you will be doing a good service to society by... I mean to say that clinic practice and hospital practice are two different things. At least I have realized now that hospital-based practice, probably somewhere we lose our independence, which is of pristine importance to us. At least my father taught me that if you become a doctor, you are not servant of anybody. You always remain independent. Whatever you wish to do, how much you wish to do, that you will decide. But with corporatization of medicine, there are a number of restrictions on the medicine where we lose our independence. I will not talk about targets or this or that. I am not going to any controversial thing. I am just saying that you lose your independence. If the patient comes, you have to listen to him. Even if he demands unreasonable things, first keeping your job, you have to listen to them. Medicine was not meant like this. But this is a phase, I hope it will pass. But now at least I feel in the clinical practice, if you do your own clinic practice, you can say yes, no, whatever you feel is good for the patient. But you are not bound by somebody else. I mean MBAs, these managers. They have never touched a patient. They just see spreadsheet, Excel, this and that. Very sadly, very few hospitals in India are looking at clinical outcomes of the patient. They are just looking at spreadsheets. So I'll humbly suggest everybody, after MBBS, certainly try to do an MBA in health administration. You may not become an administrator, but you will get an idea why certain administrator is telling you to do something. I realized this thing very late in my life, that corporate by its genetics is made for profit. Medicine by its genetics is made for patient relief, patient treatment. But sadly, now patients are called clients. In last 20 years now, hospitals are calling patients as clients. We were told never to treat patient as a client. Even if he doesn't have money, we have to treat them. So this is a difference which has come in medicine, and this will follow the American model. This we cannot control. That is why CTVS people are reluctant to take. Maybe neurosurgery people are reluctant to take. And you'll find extreme shortage of neurologists, extreme shortage of rheumatologists, extreme shortage of endocrinologists. But surgeons you will find. I'm not saying that they are unemployed, but you will find. And second thing I'll say is that if you do your degree, go to periphery, non-metro cities, where you are needed. So this is my message to all the aspirants of specialties. Choose your specialty once and do think about what I said about MBA. In England, it has become mandatory that in MBBS they have integrated MBA. So that doctor also understands how money is earned and how money is spent. How much money if a hospital can spend. If I ask my hospital for 50 crore machine, so I should have a basic idea, if not a manager, I should have a basic idea that how the 50 crores is going to be covered. So that MBA is a part of becoming a integrated course in US. At least England I know very sure that they have to go for 1 year MBA along with MBBS. And in India it should also be integrated. I hope government listens to it, or people can apply online and do executive MBAs. It is really very useful because money rules the roost.